Welcome to the FreshRN Podcast. The information contained in this podcast is meant to supplement your existing knowledge and not replace it. Always refer to your state board of nursing, standards of care, and respective institutions' policies to guide your practice. All identifying patient details have been changed to protect their privacy and remain compliant with the Health Insurance Portability and Accountability Act of 1996. Thanks, nurses. Stay fresh.
I think I can belt out somewhere out here.
Let's hear it.
Oh, wait, he's recording.
Sweet Caroline.
All I do is win.
This sounds like a joke I should get.
On delay with my trumpet. I don't even think that's a real British accent.
Are we going?
Oh, we're going.
Are we live?
We're live?
That's
And that
recorded.
needs to go on the clip. Or can I just pretend and hide behind my microphone?
I did that thing where I pretended like I knew you turned over.
He is super hot.
I'm sorry, Dave. I can't do that.
What's up, guys? Welcome to the episode of the FreshRN Podcast on interviews. I am Katie Kleber.
Hey, my name's Elizabeth Mills.
And I am Melissa Stafford.
So this episode is basically going to focus resumes, applications, and the largest chunk is going to be on interviews. I think that's what people kind of get the most anxious and squirmy wormy about and stuff. So let's jump right in. So this is really for the new grad, maybe, or maybe the nurse that wasn't necessarily working maybe inpatient, or something like that. So one of the most important things about your resume is that it's got to be perfect. Like, no, you can't be having errors on that resume.
No typographical errors.
Yes. You have multiple people look at it. Like, don't just like write it up real quick and think, okay, I think it's fine. It'll be fine. No, it won't be fine. You have to have your resume is what is speaking for you when you're not there, when the person reviewing resumes is reviewing 200 of them.
Absolutely.
So if you have an error, or if you're like, something's not accurate or whatever, like, it is very easy to say, okay, this one, no thanks. You know what I mean? Another thing for new grad specific is do not put every single clinical experience that you have had on your resume. I've noticed that a lot when I see resumes from new grads is it's every clinical experience from school. And if you have graduated from a nursing school and have a nursing degree, or you're getting ready to sit for boards, I realize that you have had a certain amount of clinical experience, right? I don't need to know every little clinical thing that you've done.
But so has everyone else who's applying.
Exactly. So now the exception is, let's say you're applying to the neuro ICU and you did a preceptor thing in a neuro ICU. Like, that would be great to include.
Yes.
But to have, like, I did however many hours in OB and I did however many hours in mental health, and like, that's completely unnecessary. I would actually, as someone reviewing applications, would rather know about your other work experience. But I know it can be kind of challenging because some people go straight from high school to college, straight to nursing school, and they don't really have a clinical experience to put on there outside of school. So I think that's why a lot of people put all their clinical experience, but try to resist that, I guess. That's probably one of the biggest resume mistakes I see.
I mean, maybe it's more important to put things like if you volunteered, or if you worked in some kind of student organization, or were part of some student organization in college or in school, or if you were a part of your American Association of Student Nurses, or
right.
something like that.
And one of the things, too, that when I was talking to a bunch of new grads, one of the questions they had was, it's not realistic for me to do all of I can't be a CNA and then be the president of NSA and then do nursing school and do all this stuff. Like, what do I do? I feel like I should have all that stuff on there, but I can't physically do it. And I'm like, well, of course you can't have all that stuff on there. That's too much stuff. But if you were maybe really involved with, your Nurses Student Association, but you weren't a CNA, but you have some great experience in the NSA, like, that speaks for itself. Like, you don't feel like you have to do all these different little things just to have them on the resume. You know what I mean? Like, do a few things and do them very well and get good references.
And you should really cater your resume for the area that you're trying to apply for too. So, what is most important to put on your resume if you're applying to an ICU is different than what you need to put on your resume if you're applying to work, say, in a skilled nursing facility.
Yes.
Or in a doctor's office. that there are different things that are going to benefit you in different ways depending on what you're trying to apply for.
Right. Another thing is if you have a longer work history, but relevant work history, not every little thing. So if you're 45 and you're applying as a new grad, when you were 19 as a server at Outback, that might not be necessary if you've had multiple jobs since.
Unless you saved someone's life by doing the Heimlich or
CPR.
Saved someone from getting something that they had an anaphylactic allergy to. They couldn't have shellfish, and you saved them from getting
the shellfish out of their
shrimp
hand.
on the bobby. Then you're good.
Then by all means, put that Outback Steakhouse.
It shows that you pay attention
to things.
Yes.
Yeah.
that
All right.
you apply what you've learned.
That's
Yes.
right.
So so keep in mind that the person that's reviewing the resumes, especially because a lot of times what happens is if there's an open nursing position or a new grad residency, there are just a few people reviewing hundreds of applicants and reviewing hundreds of resumes. So what's going to make you stand out? Is it that you maybe did some volunteer experience and you were a CNA and you have some good references? And one of the things I want to say about references is that a lot of people just want to put their clinical instructors, which is great, but everybody's going to put their clinical instructors. Who do you have that can really vouch for you? Like I asked when I was doing mine, I actually asked when I did my preceptorship, so my larger focused clinical thing senior year, I did it in a small emergency department, and I asked a couple of the physicians to write recommendations for me, and they did. Yes.
Yes.
Things like that, or the physical therapist, or maybe nurse, not just your clinical instructors, but nurses on the unit that you did clinicals with, or maybe if you had some experience with a manager, and ask that manager to write your recommendation. But honestly, your networking begins in nursing school because a lot of people get jobs based off of the networking they complete in nursing school. So actually I posted something about that a while ago, and it was, I said something about networking in nursing school, and 20 people were like, oh, the reason I got my job, I'm working on a unit I did clinicals in.
Yes.
So so don't make a good impression, I think, and then have some of those people be cheerleaders for you when you're applying and include them on your resume. Yes. I think that's and one other one too is don't just think they have to have this clinical role. When I did my volunteering, I volunteered at a very different hospital, but I had to go through this volunteer service coordinator person, and I asked her to write me a reference. And it was at the so she was technically a director of her service line not service line, I guess it wouldn't be a service line, but her department. So that looks pretty good, right? So to have
I'm actually impressed by your resume just sitting here.
I know.
I'm thinking
I didn't
wow,
have
I didn't do this
well,
when I got
no,
hired.
I didn't either.
Well, I was kind of like, what are these doctors going to say? No, I'm not going to see them again after next week. If they're going to say no, then so what?
Well, and it reinforces the importance of being on your game when you're a student too. If you take
Yeah.
it seriously
Mhm.
and really get engaged with the department that you're working in, it can really make an impact on you getting a job later on down the line. So I think that networking, I definitely underestimated the impact of networking as a student. And honestly, until the last few years, I really kind of just neglected the importance or didn't really recognize the importance of networking even now.
Mhm.
I'm amazed at how many people sometimes, oh, I've heard your name before. I'm like, really?
How
How
know
did you hear
me?
my name?
Yeah, I used to
You
think networking was something that only applied to nurses in the administrative side of the field.
Yes.
But it truly applies to starting with a nursing student. I can't remember what the statistic was. It wasn't nursing related, but it was just 70 or 80% of jobs, people get them because of networking, not because they had the perfect resume, but because of the relationships that they had built and people who knew them and knew that, hey, you are reliable, so I'm going to recommend you for this job. So I can't begin to tell you how important networking is. Then again, the resume looks good, and that you have other people, you have a great amount or variety of references.
Mm-hmm.
Next, a couple points on your application. Don't wait until you graduate to start applying.
Yes.
You'll go months without getting a job. I applied for a new graduate residency in January. I didn't hear back until April. I had an interview in May. I graduated in May and got a job offer in June and started in July. Yeah. That's,
And honestly, HR departments are really slow.
They are.
So the people that get
Yeah.
in their applications earlier are going to be the ones that get the jobs quicker. They're going to get the most attention.
Yeah. And HR, yeah, they are slow. A lot of HR departments have a lot of turnover themselves.
Mhm.
And the nursing has turnover. And HR processes don't necessarily match up with the needs of nursing and how
Very
quick
true.
that we need it to be fulfilled, or positions to be filled. So it's kind of sucks. You would think that, oh, this unit really needs nurses and they'll be able to get somebody in quickly, but that's not usually the case. So if you think, okay, let me just finish school and finish boards and then I'll apply, you might be waiting a little while.
Yes. Yes, indeed.
Yep. Oh, and I have seen, because I've been looking at some new grad new grad residency kind of things, application processes. And I've seen a few hospital systems that are requiring their new graduates to submit a video interview
Really?
using their cell
I've
phone.
heard of that. I've heard of that.
So just to give you a couple tips on that, when you're recording yourself and submitting it, don't look at the floor the whole time. It is kind of natural when you're doing that. Even if you think about even when you're on FaceTime, it's kind of awkward to stare at yourself.
Yeah.
And so the natural thing, if you pull up your phone, put it on camera and start doing a selfie, and turn on video, the natural thing is to look at the floor. It's really weird, but try and make some eye contact with the camera. Also be cognizant of what's behind you.
Yes.
So if you got your undies hanging out
Don't
of a
let a
hat,
mirror be behind you.
Yeah. No, so, keep that in mind. You might have a wonderful interview, but if you've got some questionable items behind you, it's really hard to pay attention to your interview. So those are just some things that people might not think about.
Yeah, there's a lot of things on the internet that show examples of that.
Yeah, and also those, make sure, don't wait until the last day to do that, because if you're not sure technically how to do some of the steps, you want to give yourself a little wiggle room.
And
So-
time to re-record too. So
Yes.
if you do it and then you look at it and think, yeah, I didn't like how I said that, or
Mhm.
maybe, maybe I don't, honestly, it sounds kind of vain, but the truth is, like, whatever you're wearing kind of blends into the background or something. You need to stand out.
Yeah.
Maybe how you think you look wearing whatever outfit you put on is not exactly how it looks. So you
Mhm.
have a chance to change something and make sure that you look as professional as you want to look.
Yeah, and
So-
one of the things that I've done when I've had to record things on my phone is I'll set my phone on my laptop so it's facing me and I don't have to hold it up the whole time,
Mhm.
because it's hard to concentrate on holding it and having it having the frame look good, and your arm gets tired, and then you're thinking about your arm getting tired, and you're also thinking about, why do I want to be a nurse? And I'm telling you, so keep that in mind too. So that's some application stuff. So let's talk about interviews, because I think this is what people get the most kind of freaked out about. One thing to remind you is that your first impression starts when you begins not only with the resume and application. We'll say, yeah, we've already seen that. But my first impression of you as a person begins when we're trying to schedule your interview. So if I'm having a heck of a time finding a date that works for you,
That doesn't look so well.
it does not. So this job, I'm hoping, is a priority to the person I'm scheduling. So if I present 5 dates and none of them work, I get that people have things going on in their life, right? Like maybe you have commitments, but if it is really tough to get you for an interview, I'm already a little like, meh.
You're skeptical because you think, what's going to happen when I'm scheduling them for work? Are they
Right.
going to fight me on the schedule, or is this going to be somebody that's not going to want to work weekends or nights or
I mean,
holidays?
I don't know. Maybe it was the time that we applied for jobs, but I actually had to travel to Charlotte from school.
Mhm.
But my roommate and I, we both interviewed at the same facility, and we were like, okay, when we talked to HR, we're like, we've got this long weekend, can we come Friday? I guess I was just like,
Bending over backwards to
bending over
accommodate.
backwards, and and obviously I'm in school, I'm out of town, I'm coming in from out of town, and I guess I mean, for people, if you're interviewing for a job, I just think I don't know, common sense would be that you would be as accessible as possible.
Yeah, unfortunately, not everybody is. And I've run it. Yes. Yeah. It's like, okay, then I just don't want to interview anymore or interview you anymore. I didn't know this was going to be like pulling teeth trying to get you here to interview you. So keep that in mind.
Return phone calls when they make them.
Yes. So if it's like you're playing phone tag, like try to be available, Second thing is to look professional. Doesn't mean you have to go out and buy this like super nice, like expensive suit and go into debt, or like go get your hair blown out I mean, it's important to look like you care. I mean, I know there's all these etiquette things that you can look up, and technically you should do this and should do that. But if you're putting effort in to show that this is important, and even if maybe you're a student and you scheduled an interview after a clinical, like, before you go to the interview, like kind of pull yourself together a little bit, run a comb through your hair, like
you've worked for the past however many years for this moment to start your career. So you do need to take some time and some pride, and
yeah, and how you
roll out of
yourself.
bed, and
Yeah.
Interesting.
So it's and keep in mind we're saying these things because we've seen it happen.
Oh,
So
absolutely.
something I like to do. This isn't like necessarily required, but something I do, and when I see someone else do it, I'm impressed. Is when they come to an interview and they have their like a little leather bound portfolio kind of thing where they have some notes written in it, and they're not just walking in with like a couple extra folded up copies of their resume. Like what I've done is I have like my leather portfolio, and I'll have a few extra copies of my resume printed on resume paper, and then I'll hand those out to whoever's interviewing me. Usually, even if it's a panel like of people, like, here you go, here's just maybe I updated or whatever, you go, and it just looks nice when you do that, and if you have papers that you need to bring, it looks nice if you can come in with like a leather portfolio instead of kind of pulling loose papers out of something, or maybe a nice you're not bringing a backpack in, like that kind of stuff.
Or a whole stack of loose papers, like you said. I mean, that, and if you have something with notes on it too, it kind of shows how you've taken the time to think about this interview.
Mm-hmm.
And, you probably know the types of questions that you're going to get asked. And so take the time to think about them before you go in there.
Mm-hmm.
The more put together that you sound, the better you look to your future employer. So, and the other thing is if you know the facility that you're applying to, knowing information about that facility, showing that you've looked up information about that. I see that you're growing your neuroscience program, or I see that you're building a new cancer institute, or I see that you're now a level 1 trauma center. Things that show that you have invested in taking the time to look up that facility really show that you're a go-getter, and that you really try and what's the word I'm looking for? That you're proactive.
And you've done research, and you've shown interest.
Again, showing you care. That that really goes into how important that is, and that just shows that you care and that doing your homework. Like, I can't begin to tell you how good that looks. So that's what I've done. Like, because I remember I was interviewing first at a school at a couple facilities. So when I went into those, not only did I write down a couple mission, vision, value kind of things and kind of worked it into the conversation, but I went over questions beforehand, because when you do patient care in clinical setting, you'd think you'd be able to remember stuff at the drop of a hat, but it really blurs together. And then when you're in a little bit of a stressful situation where someone's interviewing you, it's hard to recall that information.
Now, have you ever just thought, I should have said that?
Oh, yes.
Like 5 minutes after your interview ends, I should have said that.
That would have been the perfect example. I missed the job because I forgot about blank.
Yeah.
So I highly encourage you the night before just to have, even if you do it alone or have one person ask you a question or a couple questions, things to think about. A lot of hospitals will ask you, why did you go into nursing? Why do you want to work at this hospital specifically? Tell me about maybe an issue that you had with customer service before and how you addressed it. I got that one in an interview once. Tell me about a time when you had to advocate for a patient. Tell me about a time in which you didn't know how to do something and how did you address it?
Which I think as a new nurse starting out after, that's a really hard question to answer. Because as students, I just think that's a really difficult question. So, maybe if you haven't had that experience yet, you can talk about something you've observed as a student.
That's a good point. If you have not had that experience, just say, I haven't had that, but I did watch this and it wasn't my experience, but I saw it and this is what I thought.
Because, I think that's a question that's always asked in every interview, whether you're experienced or a new nurse. But, if you feel like you really haven't had that situation or come across or dealt with that situation personally, maybe you've observed it.
Yeah, so so if they ask you a question, that's a really good tip. Another one is to be personable and relatable. Don't be some like robot that I just have to go in and answer the questions and bye. Like, be nice to the receptionist. Don't loudly talk on your phone in the waiting room while you're waiting to interview. Show up early. If you're on time, you're late. And if you're not sure where to go, do a dry run the night before.
Yeah.
The worst thing you can do, not the worst thing, but showing up late really doesn't look great. Be personable and relatable. Again, part of being a nurse is being, a warm, compassionate person.
With people that you don't know.
Yeah. Yeah.
You don't know the patients until you walk into the room, but somehow you can still manage to be personable and approachable and friendly. And you need to remember that when you're being interviewed, is if you can't be personable and friendly and kind to the people who are interviewing you, they're thinking, how are they going to take care of patients that they've never seen before?
That's a really good point, y'all. That's a really good one. So that's really important. You want to make sure that it's hard to do that. It is when you're like interviewing, but try as much as you can. And then one of the last tips is to always have questions for them. So remember, you're kind of also you're also doing this interview to see if this place is a good fit for you too. Like it's a two-way street. You going into this interview, I'm a great nurse. I'm going to be an asset to their team. They, like you kind of walking that fine balance of being confident, but not cocky, like humble and hungry kind of thing. Like I know I'm going to do as good as I can, and I would be a great asset to this team kind of thing. So, if you're a great nurse and employee, they should want to have you as well. So I think one of the ways that you exemplify that is so now that we've gone through the interview and at the end, I do have questions for you. So what's the turnover rate at the hospital? What is the norm? What's your patient to nurse ratio? Has that changed recently? Do you have a clinical ladder program? Do you reimburse for certifications? What else?
Is this a magnet facility?
Yeah, or are you? And if it's not a magnet facility, are you looking at going on the magnet journey? How do you have shared governance set up? So those kinds of questions to see, because you know what? Honestly, if I was interviewing at two hospitals and I got pretty much the same vibe from both places, I would look very heavily at those kinds of questions. If one hospital has a clinical ladder and has a way of recognizing nurses and has a lower turnover rate, but a slightly lower pay rate, I'm going to that one, So those are really important things to consider. And then after your interview, I highly encourage you to send a handwritten thank you note to whoever interviewed you.
Handwritten.
Yeah. Not, you could do an email if that's all you got,
This is very insightful. Because I never would have thought to do that.
Really? I've done that with all my interviews is a handwritten. So, and then say something like,
with good penmanship.
With Melissa Stafford's penmanship.
Yeah.
She's got the best handwriting.
Yeah, you do. It's like natural calligraphy.
Yes, it is. It is. So
Thanks.
what I tried to do is make sure I get a card from whoever I'm getting the interview from. whoever I'm being interviewed by. And if I don't have it, then I'll just send it to the hospital care of that, you know. But make sure that, and then I do it that day so that they get it the next day or two, so that when they're thinking about okay, man, who am I going to fill for this position? Oh, look, I got a handwritten thank you note in the mail a couple days later. Like, and it puts you back in their mind, or puts you back in their mind. So I say something like, hey, Ms. Smith, I just really want to say I appreciate the time that you took to interview me. I really enjoyed getting to learn more about your facility and your unit. I think I'd be a great addition to your team because of blank, blank, and blank. And thank you again for your consideration.
Yeah, it doesn't have to be long. Short,
Yeah.
sweet, and to the point. And handwritten, I think, just I don't know. It's much more personal.
Mm-hmm.
To your point earlier, I mean, email is better than nothing.
Right.
Because this is the
That's a good
digital
point.
age after
Yes.
all. But, it's really important for you to kind of reach out after the fact too,
Mhm.
because, there's going to be a lot of new grads coming up and you want to set yourself apart from other people.
Mm-hmm.
And that, you never know, that might be the one thing that sent you over the edge of
That's true.
your peer.
Good point.
So I want to finish this episode by kind of talking about our personal experiences with interviewing people. And I wanted us each to kind of go through the best person we saw interview and the most frustrating. And I think let's start frustrating first so we can end on a really high note. And I think Melissa wants to start.
I thought of this last night, actually. It really stood out. I had a new graduate RN who it was a second career person, so definitely had work experience that was not related to healthcare. But I remember sitting in the interview and we had asked some of these very questions here. One of them being kind of related to tell me about a time which you didn't know how to do something. And I think they tried to turn it into well, I didn't experience it, but this is what I saw moment. But basically didn't do anything but judge an experienced nurse for handling something wrong. Like, they didn't do this, they didn't do that, they didn't do this, they didn't do that. And all I could think of as my mind was, you're a new grad. Like, do you know what was going on at that time in its entirety with a patient? Are you really at a point where you understand what's going on with the patient, that they maybe made the decision to give whatever medication or what have you? And I find it very hard that someone who has absolutely no clinical experience, with the exception of school training, to be able to make a judgment on a nurse that's graduated and out there. And I think that just reflected poorly upon him because, maybe it really was an issue, but in my mind, I'm thinking, yeah, I don't know that you're really in a place to judge somebody else right now. And that really was kind of a turnoff for me, honestly.
Mine's similar in that it was like whenever we asked a question, the answer was always when someone else screwed up. So it was like, when they're asking you questions in the interview, we want to learn about you and how you've done and whatnot. But to build yourself up, you've got to talk poorly about those around you.
Yeah.
That tells me a lot.
It does.
So that was one of the ones that I was like, ugh. And then I, also had some where clearly the person didn't put effort in. I don't need someone to look like a supermodel or whatever, but I can tell when someone's put effort in to looking decent for something. And I don't care about like specific outfits or whatever, but it's just like, if you care, that's what matters to me.
Yeah, don't look like a slob.
Yeah, like I got dressed for work today and I came and looked respectable, and you're trying to get a job here and you look like you just rolled out of bed. Like, no. So those are my frustrating ones. But do you have any?
I'm going to go back. I'm going to go I remember actually answering this question in one of my interviews. I was asked, tell me about a situation where you had to advocate for your patient. And this was a situation that I experienced in nursing school. And I had actually had a patient who was getting transferred to another facility. The patient had been in like a really bad
Accident?
It was an accident, but it wasn't like anyway. The patient it was a trauma patient. The patient had like some crushing injuries to his legs and his hands, and Anyway, we were getting ready to, the EMS was at the hospital, had come to the hospital to transport the patient, and they were already like, they were late getting the patient. And of course, the patient had to get to this one facility by a certain time. I can't remember all the details, but I remember explaining this situation, and I remember saying, well, the medic didn't want to wait for us to go get the patient some more pain medicine, and the patient was in a lot of pain, and we were getting ready to transfer the patient over to the stretcher, and it was, the nurse was like, hold on, let me just go get some medicine, and medic was like, no, we're not waiting. And it was one of those situations where I was like passing the blame I was passing the blame on, or judging medic. And I remember the person who interviewed me was like, well, that nurse still had the choice to say, stop, I'm going to get my patient some pain medicine, and then we can transfer over.
Mhm.
It was a long time ago, and it's hard to remember all the details, but maybe I did, when I was explaining or giving that example, I was also judging,
Mhm.
what other people have done or what other mistakes have done. But, it's, in a sense too, it's hard because I think as students, we, you're always looking to see what is done. I don't know, maybe what's not always done right. So in an interview, you're trying to think of a situation that could have been done better.
Yeah, and it's like there's so
And
many.
you're naive in the eyes that you're, the way you're looking at things. So I don't know, but those questions as a new grad are hard questions to answer. And so sometimes maybe you can't give specific examples of your experiences as a student nurse. Maybe you can give an example of, a situation outside of nursing where you've had to,
Mhm.
Stick up for somebody, or advocate for something, or
maybe you had to advocate for a loved one when they were in the hospital.
Absolutely.
Something like that. I think, when you're in nursing school, you're told you're wrong a lot, and it's like when you have those situations where someone else was wrong, it's kind of like,
You're
So-
showing that you recognize there was something wrong.
right. And there's a way
Yeah.
that you can communicate that doesn't show, that's not like, this person totally screwed up. But you know what I mean? So, I don't want you to say you can't ever talk about that, but it's just the way that you present it is really important.
No,
Very
it's
important.
the sense that you don't want to sound, I guess, not condescending, but maybe
Judgmental, especially in
Judgmental.
this brand new role. I think it's really important.
Yeah.
That might go back to the whole know-it-all. Is this person going to come in thinking they know everything already?
Right,
I
which is
don't
a
know.
really difficult person to orient.
Mhm.
And then my interview, an interview I had a couple years ago, it lasted like 2.5 hours. I'm not kidding.
Good Lord.
I was in a room with like 4 or 5 people from that unit who interviewed me, CNAs, nurses, and it was like, I was like, oh my gosh, I've been here for so long. And actually what happened was I had worked the night shift and driven down from Virginia to come to this interview, and I was so tired, and this nurse had asked me this question, and I started going into the story, and I completely forgot what the nurse had asked me. And I was like, I'm so sorry. I was like, can you repeat what you just asked me? Because I totally forgot. But anyway, it was a long interview. It was probably the best interview I had. They asked every possible scope of question you could have thought of. I mean, but it was a great interview. It was one of the best interviews I've ever had. Anyway,
Yeah.
I just remember I was like, oh my gosh, I can't believe it. I'm thinking to myself, I can't believe
I'm rambling right now.
I don't
What am
remember what they asked of me.
What's my point?
Yeah.
And I have a
so
bad habit of doing that anyway.
What are, in times that you guys have interviewed somebody, the best one that sticks out in your mind?
I don't I know I've interviewed people, but at this very moment,
I do have one that sticks out profoundly, and it was like, not that this person came in and looked perfect and had the perfect answer for everything. Actually, the reason I knew that I really liked this person was because when we asked a question, and I honestly can't remember the question, but she paused. She was like, hold on, let me think about that for a second. And we sat in silence for a little bit, and it was a little awkward, but it was okay. And she was like, you know what? I can't think of an answer for that one. And we were like, you know what? Okay. Like, she didn't try to pull something out of her butt and make it up or BS her way through it.
Mhm.
She took the time, and I love it when you're communicating with someone and they're actually listening to what you're saying and and then wait until you're done talking to think about a response versus having the response ready to go until you close your mouth.
Yeah.
And she like waited.
Yeah, is it cool to BS or is it cool just to be like, I'm not quite sure?
I don't think there's a hard and fast rule with that, but if I'm interviewing someone, I would much rather them be honest with me than BS me. If they don't know the
You
answer
get
to a
caught
question,
in the BS. Does not look good.
right? Like, I want an honest nurse that's going to say when
I
they
don't
don't know
know.
something, and they're going to be okay with being awkward and silent and thinking. Like, I want that. I don't want someone who's going to tell me what I want to hear. I want them to tell me an honest answer. So that's kind of that's my thought process. And also, she was very shy, very timid. She wasn't didn't interview perfectly, but I liked that. And I liked that she was timid and that, you know what? I think that she's going to make a good addition to the team, even though you could hear she was nervous. You could hear blah, blah, blah. But so that's the one that stuck out the most. And she got the job.
Another thing I think is important as a student nurse. I know in most like BSN programs, your last semester you do not a preceptorship, but what's it called? There's a term for it, and it's
I
the
did a
tip of my
preceptorship.
tongue. Capstone.
Mm.
And in that capstone experience, you often are asked, you have to keep like a weekly journal, and some of those questions that you will be asked in interviews, you are asked in this capstone. So keep record of that.
Oh, that's great.
Because I remember I had a capstone student last year or whatever, and we were going through these questions together, and she was like, what was the situation? I said, do you remember that situation where we had with such and such? She was like, yeah. And I was like, that would be an example of advocating for your patient, or that's an example of critical thinking or whatever.
Mm-hmm.
So there's a reason why you do those journal experiences or keep records of that stuff. Keep it on you, because those you can use in your
And after
interviews.
years of school, stuff really blends together. So it's hard to remember specific patient experiences. But do you have someone that stuck out the most to you?
I do. I think that working in a neuro ICU, obviously, we have a very specialized need for nurses, and a lot of people are intimidated by neuro, but we happen to have.
But we're so friendly.
We are friendly. Are you kidding? We're the best. But
Yeah, we are.
But this particular nurse had done a preceptorship in a neuro ICU in another facility somewhere, and I'm always curious about what did they retain
Mhm.
during said preceptorship. And this particular nurse, when we asked her some questions about, tell us about a memorable neuro patient, and it didn't have to be neurocritical care, but any kind of neuro patient, just to get an idea of kind of where her thought process was, and did she kind of get a basic understanding of what was going on with the patient. And she not only just completely knocked it out of the park, she was able to give very specific examples related to patient care.
Mhm.
She paid attention to the equipment that was in the unit.
Mhm.
So she used the term ventric. I'm like, what?
Oh,
You
you're
know what a
speaking my
ventric
love
is?
language here.
Really? 'Cause I honestly wouldn't
Ventriculostomy.
expect a new nurse to know what that is. Honestly, if you're coming for an interview, I wouldn't expect most student nurses to
Right.
know what a ventric is.
Yeah.
But the fact that she did and was able to speak about it properly was like, ooh, you have a halo around you,
Yeah, yeah, because
So
I think too, because I know who you're talking about, and we had other interviews earlier of people that had experience in nursing school in a neuro ICU that did not know what a ventric was, and then she did, and I
Mhm.
was also blown away.
Mhm.
And like, yeah, you're paying attention to some details that are important, like maybe in nursing school, you're not going to be managing that, but clearly you paid attention.
yeah,
And
absolutely.
you were interested. So if you're like applying in a cardiac ICU, like using some cardiac ICU buzzwords or ICU buzzwords, those kinds of
Right.
things.
I saw a patient who was on a balloon pump, and I thought that was really cool. And I don't really remember much about it, but I remember it was a really big deal.
Yes, or
an oscillator or CRRT or whatever.
Yes.
Obviously, this is critical care, but anything that you can use specifically related to the floor that you're interviewing for is really, really going to be beneficial.
Yeah, and you think about if you were interviewing with us, we love neuro, and if you speak our neuro love language, which is that's important that you're showing that you're interested in it. It's not like you'll just take any job and just do whatever.
I just want a job.
Right,
That's it. And
yeah.
that's a terrible attitude to
Yeah.
portray, honestly.
Because that might be someone who may work there for a year or two, but it's not someone who's in it for the long haul necessarily. So, did you guys have any more resume application tips?
No, I would just say aim high.
Yeah.
Honestly, go for what you want.
Mm-hmm.
And going for what you want means you're going to have to get your applications in early.
Yeah.
Get a good resume together, but aim for the sky.
Yeah.
Honestly.
Yeah. All right, guys. Well, thank you guys so much for listening. Check out FreshRN.com for some more blog posts and podcasts and gear and all that good fun stuff. So, thanks, nurses. Stay fresh.
Damn girl better hit the floor. All the other fellas better run for the door. Stop.